In another aspect of pharmacodynamics, we're going to discuss now quantal or cumulative dose response curves. Now, what these curves are going to be plotting, although they look the same, they're very different in that rather than looking at several doses in the same individual on the same receptor, we're going to take a population of patients. And imagine, let's say I'm taking 100 patients. And first, in those 100 patients, let's imagine I give 1 milligram of drugs. Then all I'm going to do is count how many of those 100 patients receiving 1 milligram of that drug actually have responses or have toxic effects. Then as I increase the dose, and now I give 2 milligrams to those 100 patients, I can repeat this and now look at how many more patients now have effects that are either therapeutic or toxic. Ultimately, I will plot, as I increase the dose, the population as a percentage that responds to that drug. This allows us to estimate what we call median effective doses, ED50, but also median toxic doses, TD50. In some cases, hopefully not in humans, unless you really don't like your patients, you can also estimate lethal dose 50, the doses that would kill 50% of a population. Now, normally this is done obviously on cell cultures or in bad cases on animals in developing drugs. The idea will be then to contrast these numbers. And contrasting these numbers will allow us to very much come up with what we call a therapeutic index. The therapeutic index, we'll explain, is really an index of safety and something not to be associated with toxicity of a drug. So to explain this, first let's just define the therapeutic index. A therapeutic index, as you see on your screen, is pretty much calculated as a ratio. It is the ratio of the dose that is toxic or lethal in 50% of the population divided by the dose that is efficacious in 50% of the population. What type of therapeutic index values are you looking at? Hopefully, you're thinking like I do, that you would like the TD or LD50s to be huge numbers compared to the ED50s. As a result, dividing huge numbers by small numbers, therapeutic indices, hopefully are large values. And indeed, the larger the value, the more spread out the doses that are toxic in half that population are from the ones that are efficacious in that population. There is no better way but looking at a diagram here called quantal DR curves of therapeutic and toxic effects of a drug. Looking at a diagram will show you very well the spread between therapeutic doses and toxic doses. In the example given, you notice that a dose of 2 milligrams per kilogram will result in 50% of your population having a therapeutic response. As you increase the dose, you build more and more therapeutic responses in that population until around 4 milligrams per kilogram, when you will have achieved for 100% of your patient population to have therapeutic responses. On the same diagram, we've also plotted the responses that would be deemed toxic for that drug, although we have no idea what toxicity is referring to here. Is it a simple pimple on the nose, a little rash, a little edema around the ankle, or is it someone having a heart attack, a seizure, or a blood toxicity that results in some significant risk of infection? So whatever the toxicity might be, hopefully simply nausea and vomiting, we notice that they start appearing, those toxic responses, once we are around 6 milligrams per kilogram, and 50% of that population had toxic responses for 10 milligrams per kilogram. Beyond that, ultimately, we would have 100% of our population having toxic responses. Now calculate the therapeutic index for me based on that diagram. You remember that a therapeutic index is the toxic dose for 50% of the population divided by the therapeutic dose or efficacious dose for 50% of the population. Here, 10 divided by 2, giving rise to a therapeutic index of 5. All this is telling you is that there is a 5-fold difference between the doses efficacious in half the population from the doses toxic in half of that population. Does it tell you whether the drug is very toxic when you use it in the therapeutic range? The answer to this is absolutely not. This is not giving you any idea whatsoever as to side effects when you use the drug. Rather, what it's telling you simply is if you were taking 5 times more of the drug, rather than being in the therapeutic curve, you'd be in the toxic curve. Is that safe? Well, the answer is no. You know, if you only have a 5-fold difference between therapeutic effect and toxic effect of a drugs, you can imagine what would happen when you prescribe that medication. Think that you want that prescription to be used for 10 days. Maybe it's an antibiotic. Do you think over 10 days the patient goes home with enough drug to actually take 5 times the dose that is required? Obviously, it's a possibility. Think that the drug is an over-the-counter drug. Then is it possible to buy enough drug to administer oneself 5 times the amount that would have caused therapeutic response in 50% of the population? Of course this would be the case. Drugs that have therapeutic indices that are in the single digits, such as our example here, are not deemed safe. These would be drugs, in most cases, where FDA would make sure that the prescription rights for that drug would be limited, in that there may not be prescription renewal, maybe drug companies may not be allowed to put but so many pills in a blister or in a container, as to try and avoid the potential toxicity. A good therapeutic index would be in thousands, to the extent that if you wanted to commit suicide with such a drug, you'd have to swallow the box and choke on it. That would be a good therapeutic index. How about side effects then when you take a drug, the toxicity when you use drugs therapeutically? Look first at that same diagram. Notice that the therapeutic range that would be proposed for that drug is anywhere between 2 and 4 milligrams per kilogram, to ensure that more than 50% and upward of everybody would have therapeutic responses. At 4 milligrams per kilogram, no one complained in this study of toxic effect, thereby telling you that this is a drug that may not be safe if you take too much of it, but this is certainly a drug that is pretty much devoid of toxic side effects when it is used within its therapeutic range. Do not confuse, therefore, therapeutic indices, an index of safety, with the potential for toxicities when you use drugs therapeutically. So how could I show you very much the potential for side effects? The potential for side effects will occur when the curves overlap, and I'm going to show you this on the whiteboard. Imagine the following scenario. The one we have in the book, where the therapeutic range does not overlap the toxic range. You remember in the book we have a nice therapeutic dose 50% of 2 milligrams per kilogram and a nice toxic dose in 50% of the population of 10 milligrams per kilogram, resulting in a therapeutic index of 5, which we've deemed not so safe. However, we said that drug very nicely within its therapeutic range would be fairly devoid of toxic effect. Contrast the drug I'm going to do in red. Sorry for the drawings, I'm not an artist, but when you look at it, if I call this drug B in red, what is its therapeutic index? You notice that the dose for drug B that are 50% toxic are still 10, 50% efficacious, still 2. The TI is still 5 for that other drug. Yet, what is the toxic potential of drug B when it's used within its therapeutic range? Therapeutic range of drug B overlaps the toxic ranges. You notice that if you wanted 100% of your patient to respond to drug B, you would already have 50% of that population or thereabout complaining of toxic responses from that drug. It is therefore the slope of those log dose response curve in quantal diagrams. It is those slopes that are to be looked at for potential toxicity of a drug when used within a therapeutic range. If the slopes are non-overlapping, the drug is going to be more or less devoid of side effects. If the curves are very much overlapping in their range, then you can expect to see lots of toxic responses even when used for therapeutic purposes.